Well, I think the past year has clearly shown the big potential and in some cases the necessity of telemedicine, of providing care, making a diagnosis at a distance, etc. So that has definitely, in all the bad things that have happened and that we have seen in the past year, been a good thing. But clearly there needs to happen, I would say, a lot at the structural level. We need to embed it into the care systems in a good and a sustainable way, so that it is useful and valuable for the users, both on the patient side, the citizen side, but obviously also on the care provider and health professional side. They need to be comfortable with it. It needs to fit into their work routine, maybe some of the structures in the way how healthcare is provided need to be changed, need to be adapted, so that there is a good, let's say, combination of care at a distance, teleconsultation, and so on, and the face-to-face care, which will definitely still be a very important part of it all. Well, this was definitely a very interesting and valuable project and initiative. Basically, the code of practice was a sort of quality mark, quality guideline, or quality benchmark, where ultimately telehealth service providers could be assessed against that code of practice and could be awarded that quality mark. So it's a sort of assessment and accreditation certification scheme that was envisioned. Now, it wasn't easy to implement it. It's a returning challenge when you have projects that receive certain funding for a certain amount of time. Then afterwards, to sort of get a sustainable business model, get all the partners on board to invest time and money, etc. At that time, as you said, 7-8 years ago, wasn't happening. But we kept on even developing the code a little bit further with a few people and partners that were involved in the initial project. We have been continued to receiving requests about the code, how people could use it, implement it, and so on. And so that shows that the interest is there. In the meantime, actually, within the International Society for Telemedicine and eHealth, which has sort of embraced or taken on board the code of practice to, not to let it fade out, but keep it alive. We do now also have a number of accreditation bodies, companies, organizations that have accreditation programs in telehealth, telemedicine, remote patient monitoring, and so on. And we are now actually working with them on taking these things forward, on making those programs better known, all ultimately with the idea to guarantee and to safeguard the quality of telehealth services. So this is an exciting development where at one point we will definitely also see if some of the contents and the clauses that were included in the code of practice are also fully embraced in those existing accreditation programs, whether there is sort of a match that can be made or the code that could be integrated in those programs. So this is currently ongoing, and I think it's a very important aspect to the trust and the safety and quality of services that are provided at a distance, that we can support how they are arranged, how they are organized and structured and set up to make sure that they comply with certain service standards across the board, let's say. So to be continued, but a lot of good news is actually will be coming out front in the next few months. Well, in terms of challenges, I think we still have a lot of them. But again, referring to what we have seen in the past year and all the things that all of a sudden became possible, some of those challenges that were, I would almost say, wiped out overnight in terms of financing, reimbursing, etc., allowing teleconsultations in regions or countries where previously it was not yet allowed or it wasn't fully regulated. We have seen that because of the necessity, it was possible. We now see sort of a reversing effect, if you want, that some of these restrictions are coming back into place. So that's what I was saying previously as well. It's about really now structuring it into the health systems, embedding it into, let's say, the standard of care in a good way, in a way that doesn't take away from the quality. There is that word again, the quality of care, in a way that it is useful and valuable and accepted by the users, health professionals, and citizens, patients. And in terms of what you mentioned there about skills gap, this is indeed also one of the things that need to be properly addressed, both in, I would say, the basic curricula at universities and so on, in medicine courses for medicine students, nursing students, but also lots of other professions or studies where proper courses need to be given around telemedicine and all its aspects, whether it's some of the clinical and care aspects, whether it's more the regulatory aspects, the technical, and so on. So that's one thing. But at the same time, also within the existing workforce, to set up training programs that will help them to become telehealth professionals, if you want, so that they are more acquainted with the way how to do or deliver a telehealth encounter with the patient, with the user, or to deliver a teleconsultation, and so on. There's lots of practical knowledge and practical experience that can be brought to people who are already in the workforce but who aren't fully familiar with telehealth service provision. And this again is something where we also within the International Society for Telemedicine and eHealth are working at with a number of our institutional members, universities, university colleges, and so on, where a consortium of these institutions is being set up, and where indeed we want to look together with them at integration of courses in those existing curricula, but also looking at provision of online training courses, providing some of that practical guidance, practical knowledge to the current workforce, healthcare workforce. Yes, indeed. I think two of the things I mentioned around safeguarding quality, assuring the trust of the users, that's one thing. And as I mentioned, we do have some things ongoing in that area. And not just we, but a number of our member organizations who are actually already experienced and experts in this matter. The other one is indeed around education and training. I think these two things combined with a lot of other, but will certainly make for, let's say, a continuation of the path that we have started, let's say, since COVID-19. Let me also refer back to 20, 25 years ago, when we were already saying telehealth, telemedicine is just around the corner. But throughout all these years, we sort of basically always had to keep saying it. It was always just around the corner, although a lot of things were happening, and there are great programs in many places around the world where telemedicine is already part of the, I would say, the standard of care, or part of the overall way in which healthcare is delivered. But we see that in many places there is still more to be done. Now, one thing I would say is that, and certainly also the SPMS in Portugal is very engaged in that, in some European programs around, let's say, the basic information highway, if you want, let's say the backbone of an eHealth system and infrastructure. I think there has been a lot of great work that has been done in the past years to assure that data is securely exchanged and accessible and so on. I think now it's a matter of building onto that information or IT highway that we have in place, or that is, that is really coming out there, that we now start building those service stations, if you want, on the highway, services in terms of the telehealth encounters that people can have with a care provider, teleconsultation services, and so on. The time, I think, is now to really take that step, and again, not as the holy grail, because it will remain a combination of face-to-face and at a distance, etc. But certainly, in many cases, it's a very useful, also very convenient way of being in touch with a doctor or even a specialist for a regular follow-up visit and so on. So I think also from the demand side, from the users, patients, citizens, now that they have gotten a little bit more in touch and they have heard more over the past year about telehealth, I think that sort of demand-driven aspect will also play a role in the years to come.